Welcome to Flowing Forward, 3 Keys to Cultivating Lymphatic Wellness on the Cancer Journey. This class is intended to capture the essence of lymphatic wellness, offering a combination of self-care, stress reduction, and emotional support in one simple practice specific to lymphedema and cancer survivorship. I am Vanessa Hemingway. I've been working in the healing arts for nearly 30 years. I started in my early 20s when I moved from the East Coast to California, first as a massage therapist and movement educator, then earning my master's degree in occupational therapy, and soon after a specialty certification in lymphatic therapy, almost 20 years ago. My passion has been to serve people touched by critical illness, whether it was HIV/AIDS very early in my career or in the last 20 years, a cancer diagnosis. I love connecting with people in this way, helping them heal into well-being, and in that process, deepening my own healing. The path to comfort and well-being in my own body, finding home here, whether I am in pain or in shame or in love, has been ongoing. I've come to believe there isn't a destination called health that we reach or even balance. These are dynamic states that we are always recalibrating toward, the way a compass does recalibrate toward true north. Mostly what I have learned and am still learning is that I need all of you. And probably because you are watching this video, you need me too. What's at the core of my clients' experience? What do they keep telling me that they are struggling with? It's a question I'm always asking, and it has a living answer, a dynamic answer. But I will tell you that in the last several months, I've been hearing 3 resounding answers. One is fatigue. They are dealing with a lot of exhaustion. Number 2 biggest struggle that I hear about is fear and anxiety, and a lot of it health related. A lot of it actually related to the possibility of recurrence. If they are in the midst of a recurrence, they'll even say they feel some relief because they were waiting for that shoe to drop. And of course, the people who are experiencing recurrence have other anxieties. So number 2 is still fear and anxiety. Number 1, fatigue. Number 2, fear and anxiety. And number 3, the burden of self-care. Cancer has already taken too much time from their lives, and now lymphedema, there can be a fair bit of resentment and anger around this. When I moved to California at 19 and met my first teacher, she was all heart with these enormous hands. She told me this: I was going to heal myself by helping others to heal. At that time, I never thought I would ever live outside of my head. I was filled with so much shame and self-hatred. I'd always felt alone in my family, though I had 3 brothers and a mother and a father. Loving feelings went unexpressed. Silence was common, punctuated by bursts of emotional and physical rage. The pain in our household affected every one of us, and we each embodied it in our different ways. Those years in my memory are all winter. Cold, dark, numbing. There's a common story many of my clients have shared with me, and maybe it will sound familiar to you. The moment they received their cancer diagnosis, they usually remember the date that they were sitting down and that the doctor went on to say many other things. But the only thing they heard that day in that meeting with their doctor was, "I have cancer." I remember vividly the day my mother sat me down and said many things, but the first was that my father had a profound mental illness. It was the only thing I heard. Though I have very few sensory memories of my childhood, I remember those moments vividly. I was sitting on top of our red Subaru wagon. My legs were bare and the metal hood of the car was warm, and the wind was so cold, but there was warmth against my legs and I was trembling. I knew that I didn't understand, and also I was certain that nothing would ever be the same again. By the time I made my way out to California, I felt like I had a profound illness that I had no idea how to cure. I understand now that's trauma, years of living in the icy cold place. Then I didn't have the support I needed. I didn't admit to needing support. I was in a cycle of emotional and physical self-harm. I felt like I was stuck and I could not get unstuck. What started to unstick me was bodywork. Becoming a massage therapist for the critically ill, you can't learn to touch someone in a healing way without also learning to receive healing touch. You touch that person and that person touches you back. I had no plan for seeking mentors and healers to help me navigate loving self-care, emotional support, and strategies to reduce my fears and anxiety. But by recognizing that these tools and strategies were necessary for my clients, I inevitably started doing myself the things I was asking them to do. So far, more than 30 years in, it has been a lot of discovery to navigate the physical and emotional symptoms along this journey of human life. I'm guessing for you too. I understand we can't control our health, like a cancer diagnosis or the after effects of childhood trauma, but I have come to believe strongly that we can always support our well-being. I have structures around me now that I am continually modifying to meet my changing needs, and vital support systems that I still invest in and that I will never choose to live without again. Things get stuck and they can be unstuck, and sometimes they get stuck again, and again we unstick them. The lymphatic system is such a powerful example of the way our bodies help us with this process. I want to share something with you that you might never have heard before. The universal healing principles around cancer treatment are the same: self-care, emotional support, and stress relief. And your lymphatic system plays a vital role in each of these. For those of you who resonated with the idea that fatigue was your number one struggle related to cancer and lymphedema, for those of you who answered that anxiety was your number one, for those of you who answered that the burden of self-care and the time-consuming nature of it was your number one, nourishing your lymphatic system can teach you how to manage your lymphedema and inflammation, how to get your energy back, how to experience incremental and increasing freedom from the anxiety and fears you may be experiencing around recurrence or anything, and how to trust your body again. Today, you will learn a simple and enjoyable practice that you can begin to do daily that doesn't take long, gives you energy rather than tiring you out, and leaves you feeling more peaceful and more joyful than when you began. I'm also going to invite you to schedule a 30-minute Vital Lymph Solutions call with me at the end of this talk, and I'll tell you more about how you can take me up on this offer as we begin to wrap up. Again, welcome to Flowing Forward, 3 Keys to Cultivating Lymphatic Wellness on the Cancer Journey. So why is the lymphatic system such a powerful ally in the healing journey? At the grossest level, our lymphatic system is a drainage system. It helps maintain fluid balance in the body by redirecting excess back into the bloodstream. Plasma, containing nutrients and wastes, leaks out of the tiny blood capillaries into the surrounding tissues. While most of this plasma leaks rapidly back into those blood capillaries, some remains in what's called the interstitium, and the lymphatic system removes and redirects it. Through an elegant series of vessels and nodes and ducts, the residual fluid is cleansed and returned to the bloodstream, maintaining critical fluid balance in our tissues. When the lymphatic system doesn't remove that excess, because the load is greater than its capacity, possibly because the system has taken a hit, for example, after surgery with lymph node removal or radiation therapy, especially region-specific, targeted to the lymph nodes, or in some cases chemotherapy, we call it lymphedema. Another role of the lymphatic system that is particularly important to you as someone who may have personally experienced cancer is its critical contribution to immune function. Lymphocytes and targeted immune cells are transported via our lymphatic system to remove inflammation-causing disruptors like bacteria, viruses, toxins, and abnormal cells that can contribute to fatigue and to illnesses like cancer. We know that stress and anxiety can create cortisol and a cascade of immune-suppressing responses that put an additional burden on the lymphatic system, increasing its load. You may be experiencing the results of a challenged lymphatic system and feeling the physical and emotional toll that takes on your life. If you have pain, heaviness, aching, swelling, fatigue, when unaddressed, this can lead to your missing days at work, missing opportunities for joy and connection with family, friends, and loved ones, less pleasurable sex or no sex, fewer workouts, refused invitations, and the emotional toll can be huge. Feeling damaged, vulnerable, isolated, exhausted, angry, and what I hear most often from my patients, just not like myself anymore. Today, I'm going to teach you a simple manual lymphatic drainage sequence with a twist that will deepen its impact. I call it Manual Drainage 2.0. Obviously, this simple lymphatic support sequence I'm teaching you today is not the whole story. And that's why, honestly, I started my company, Vital Lymph, to offer sustained and customized week by week, day by day, month by month, over a 6-month program, working together, addressing each client's unique lymphatic and wellness challenges that occur along the healing journey. But today, this drainage sequence is an excellent first step. And the 30-minute Vital Lymph Solutions call I'll be offering you is going to be a terrific second step. All right, so here we go. I want you to be as comfortable as you can be. I believe that this process can be done seated or lying down. The first step is going to be a breathing practice. All right, so go ahead and get comfortable. I'm going to demonstrate as much as I can, but I also actually think that you would be able to do this sequence without having to look at your monitor at the video itself. So feel free to close your eyes and just open them as needed if you need a visual in addition to my verbal instructions. All right, so go ahead and inhale into your belly and let the belly expand as you inhale. Go ahead and rest a hand on the belly so you can feel that you're doing what you think you're doing. Inhale and the hand will rise. Exhale and pull the belly in toward the spine. For some people who don't naturally breathe this way, this can take some practice. So I encourage you to focus on the exhale rather than the inhale. It's usually easier for people. So do a normal inhale and then go ahead on your exhale and pull the belly button in toward the spine. Then your belly will typically naturally expand on the inhale, okay? And here's where we add that little twist I was promising you. So we're going to inhale, the belly grows, and we're going to say to ourselves, soft belly. We're going to exhale, pull the belly in, and we're saying to ourselves, supple belly. Inhale, soft. Exhale, supple. This is a gift to yourself. Improving lymphatic flow. The diaphragm muscle is like the engine of the lymphatic system. The lymphatic system does not have a heart the way the blood circulation does to pump it. And as you inhale, you're saying soft. As you exhale, you're saying supple. This can be said internally. You can say it out loud. That lymphatic engine of the diaphragm is engaged as you inhale soft, exhale supple. You are actually reducing stress with this breath by engaging the parasympathetic nervous system, that relaxation and rest response. It enhances emotional well-being to inhale soft, exhale supple. Allow these sensations to bring a sense of relaxation and openness to this area. Inhaling and the belly rises, soft belly. Exhale, you gently pull the belly toward the spine, supple belly. Beautiful, beautiful. The next step is shoulder rolls. This is a slow and very comfortable movement. You're going to go up with the shoulders toward the ears. And we're first going to go forward. The shoulder blades move away from the spine. Then down. The shoulders really drop away from the ears. And then we bring those shoulder blades back together. And then we're cycling up again. Up, forward, down, and back. As you go up, I want you to say free. And as you come forward and down, the word is released. This mantra is incredibly soothing, free as I go up, and released as I go down. This is a technique for emptying the lymph into the bloodstream at the subclavicular veins. Let's go ahead and reverse the directions. So when you're next up, instead of going forward, you're going to go back and then down, released, forward and up, free. The use of a mindset shift with this little mantra of free and released invites a sense of self-compassion, self-kindness. Many spiritual practices invite people to substitute their negative self-talk with very vital and directed, loving language to change the way that we think and feel. Beautiful. Down is released, up and forward, free. Beautiful. The next step in this sequence is to clear both armpits. The armpits are the seat of the lymph nodes that drain the arms and the upper body from the collarbones to the belly buttons. So your back body, all through the side body, arms, breast, chest, okay? So you're going to kind of karate chop your hands. One karate chop hand goes into, the right hand goes into the left axilla, the left hand into that right axilla or armpit. It's a circular movement, so we're going to go up toward the neck and in, and then let it go. The active part of the circle is up toward the neck and in, and then we let it go. Up is open, that's our word. Letting go is clear. Open and clear. Feel the flow, the sense of spaciousness. Now, for some people, involving both arms is a lot. Your arm might feel heavy, might be not comfortable. So one hand at a time is fine, one armpit at a time. So I'm doing my right armpit and my left armpit with my right arm. Got that karate chop in there. It's like my hand is glued into that armpit. It doesn't leave the armpit. The circular motion is actively up toward the neck, and I'm thinking open, and then I let that circle go, and I think clear. Open, and I pull up and in toward the neck. I want to do the other side as well. I let it go and I say clear. Open, clear. Open, clear. And again, I can do both of them simultaneously. Open and clear. All of the lymph from the trunk is going to these armpits, and we are now sending that lymph up toward the neck that we just cleared. Beautiful. Open, clear. Beautiful. The next step is to clear at the inguinal nodes. This is the seat of the nodes that drain the legs and the lower body from the belly button down to the toes, okay, including the buttocks, including the lower back, including the pelvis and the genital area. The inguinal nodes are in the crease between the thigh and the pelvis, right there at the panty crease. And you can imagine that panty crease, and the hand is kind of doing another circle. The direction is up and in toward the belly button and then away. Up and in toward the belly button, and then you just release. The stroke up is balanced. The passive part of the stroke is grounded. Balanced, grounded. So it's a little hard for you to see my groin. I'm not sure that I can really get you there. I'm going to try. But essentially, I have my hand, one hand in the groin crease, going up and in toward the belly button, balanced and grounded, balanced and grounded, balanced and grounded. And if I wasn't holding the video, I would do both hands at the same time. Feel the stability and the rootedness that comes from draining those legs. Again, you're just a slow circle. The active part is up and in toward the belly button. The passive, you just let go. Active, passive. Active is balanced. Passive is grounded. Beautiful. Beautiful. You are clearing the swelling that may have accumulated in your legs, in your lower pelvis, in the genital area, in the glutes. All of that is moving into the cisterna chyli, really, and then up into the thoracic duct, where it travels all the way back up to the neck, and it dumps into the bloodstream at the supraclavicular veins. Okay, so the next step is to return to the shoulder rolls. This is a slow and comfortable movement. Hopefully you remember it. First up, ears toward the shoulders, then forward, then down, and then back. Up is free, forward, down is released. Back, free, forward, down, released. Go ahead. Really luxuriate in that. It's a slow and large movement. If it's uncomfortable for any reason, the movement can be much smaller. And we're going to reverse it. So again, coming up, then we're going to go back, down, released, forward, up is free. We are emptying now the lymph we've brought from the trunk and arms, the abdomen and legs, into the bloodstream at the subclavicular veins. I think I said supra last time, pardon me. Subclavicular, under the clavicle veins. Approach this movement with a mindset of self-compassion and self-love. Let go of the tension. Feel a sense of release and lightness. Up is free. Down is released. Beautiful. And lastly, we're going to return to the breath. So we're going to inhale into the belly, soft belly. Exhale, pull the belly in, supple belly. Inhale, soft. The belly grows. Exhale, supple. And the belly comes in toward the spine. Again, inviting a sense of relaxation and openness to your whole being. Belly open and big, soft. Belly pulled in, exhale, supple. Inhale, soft. Exhale, supple. Beautiful. So that sequence of 6 steps you just completed started with the belly breathing, ended with the belly breathing. Go ahead and bring yourselves back. If your eyes are closed, go ahead and invite them to open. If you went to lie down, you might want to sit back up. There's still some juicy things to learn here. So I really want to invite you with this practice to have a mind shift, a mindset shift around self-care. We do self-care every day, whether it's brushing our teeth, making a meal for ourselves. What if we could see self-care not as a burden or another task to be completed, but as a healing ritual? Choosing love, kindness, and support for the body and your well-being. You're going to do it anyway. So what if it's an opportunity and an honor? What if we could bring joy into the process? As a potential emotional support, this practice is powerful. Just the breathing practice is a beautiful example of finding the balance between taking proactive steps, the inhale, and accepting what is outside of our control, the exhale. And this tool is a profound detoxification practice, beginning and ending with breathing and clearing the nodes. Beautiful emotional support. The gentle movements of the shoulder rolls, comfortable and enjoyable, are a stress reduction practice in and of themselves. They can be easily incorporated into daily activities. The shoulder circles support lymphatic circulation, reduce stress, increase oxygenation, and improve overall energy levels. The shoulder circles are another detoxification practice. I really want to invite you to think about the 3 keys: emotional support, self-care, stress reduction, as really flourishing when we are consistent and we listen to our body. If you can integrate this practice into your daily life, so it's not necessarily something that's going to take more time out of your day, but rather is something that you might do during moments of stress and fatigue for a quick reset, I think you will feel that it actually gives rather than takes. You can break it up into pieces rather than seeing it as a complete sequence. You could incorporate just the breathing and the shoulder circles as a standalone tool. You could clear the axilla and inguinals before and after exercise, in the midst of exercise if you feel that you're accumulating some swelling as you move, to really help promote flow during activity. Mindset is hugely impactful. If we can approach self-care and this practice with curiosity and openness, appreciating these minutes as a time to reconnect with your body, focus on your well-being, and cultivate a sense of inner calm and balance, you will feel the difference. We can spend a lot of time actually, without realizing it, having a negative voice speaking to us inside of our heads. What if we replaced those negative words with soothing, self-loving talk. Studies are suggesting it's incredibly powerful and energizing and deeply therapeutic. Use soothing self-talk to reinforce your positive intentions. During this practice and throughout the day, it enriches the body-mind connection and it takes the work to a deeper level. I have been promising I'm going to offer you a 30-minute Vital Lymph Solutions call with me before we wrap up, and I am. But first, I want to tell you about June. When I met June, she told me she was done with cancer, but her life still felt weighed down by physical and emotional challenges. The arm swelling that had started after radiation, which she had completed about 9 months prior, had created actually what was becoming hand swelling, and it was leaving her feeling frustrated and defeated. She had recently had a cellulitis infection, and she admitted she'd had to take some time off work for that. And she was doubting her ability to accept a promotion she'd actually worked pretty hard to achieve because she just wasn't sure she had the energy to do it well. And her passions had taken a backseat. Golf, which was her love, was like a distant memory since her partial mastectomy. And now with this hand swelling, she wasn't sure she could hold her golf club for more than a minute or two without increasing swelling and pain. And she loved to travel, but she was afraid. She had heard that lymphedema can get worse on a plane, and she felt like her dreams of exploring new places were off the table now. However, after working together, June actually did this with me in what I now call my Vital Lymph 6-month program. Everything started to change. Together, using manual drainage techniques like we did today, scar and anti-fibrotic work with the cold laser and other tools, we tackled June's swelling head on, and week by week, month by month, implementing these effective strategies, we started to get it under control. A customized self-care program that evolved over our 6 months together not only reduced her inflammation, but also led to some unexpected benefits. June actually lost 10 of the 15 pounds she had gained during cancer treatment, which really boosted her confidence and self-image. I think it was mostly inflammation and water weight. And thanks to mindset shift exercises for anxiety and worry, and some changes to her nocturnal compression wear, June, who had been getting up like 4 and 5 times a night, just waking with anxiety and sometimes pain, was waking only twice now, and really just to pee. With less pain and more energy, now that we'd identified and reduced some of her inflammatory triggers that were in her diet and maybe exacerbated by the way she was exercising, she embraced that promotion, and inspired by her progress, June and her husband began planning an unforgettable golf vacation in Ireland, a place that she had always wanted to visit. I am so proud of her, and honestly, I'm proud of the work that we did together. Whether you are a year or more post-cancer treatment, or you just started it, or are in the midst of it, whether you are experiencing a recurrence or a new cancer diagnosis, whether you actually have a diagnosis of lymphedema or you don't even know if you have it, the places you are feeling are stuck can be unstuck. The qualities my clients call out as their biggest cancer and lymphedema-related challenges are qualities that I have helped them shift, and I can help you shift too. They have felt their discomfort decreasing, their pain lessening, their swelling becoming well managed, fatigue resolving, anxiety transforming. You don't need to be experiencing these challenges. As these issues melt away, the journey becomes more bearable, even pleasurable, believe it or not. We open up more to connection, quality of life improves. I want that for you. I would love every one of you to consider spending 30 minutes with me. The manual drainage massage you just learned is a beautiful first step. Manual drainage 2.0. And it's not going to be enough. I have a gift for you. A powerful second step. A 30-minute one-to-one Vital Lymph Solutions call with me. During this 30-minute Vital Lymph Solutions call, you and I will assess your biggest cancer and lymphedema related challenge together and lay out a plan for you to shift and solve that issue. You will walk away from that call with at least one strategy you can implement immediately to feel better. And if there's a way we can do more work together, I will let you know what that would look like. And if there's someone else I can recommend that would be a better fit, I will get you that referral. If you are interested in taking the next step on your healing journey with me, go to my website, vanessahemingway.com. That's VANESSAHEMINGWAY.com. You can also find that at my Instagram, vital_lymph, and on my Facebook page, also Vanessa Hemingway. And book a Vital Lymph Solutions call with me. I hope you are getting a sense of how much lymphatic work can contribute to healing on the cancer journey. A 30-minute call is an opportunity for some individualized support. Everyone's lymphatic system, each person's cancer, each individual's journey benefits from some customization. Personalized solutions made in real time as challenges present themselves, like what we do in my 6-month program, are invaluable. Take advantage of my years of expertise, please. This work is what I love to do. I am so certain that this call will benefit you and your healing. I honestly cannot wait to sit down and dive in with you, one-to-one, into your unique needs. Together, we'll explore where you are right now in lymphatic health and how I can support you to feel better. You'll be amazed at how good you can feel just by taking even this step toward investing in your well-being. Just head over and book a Vital Lymph Solutions call at www.vanessahemingway.com. Thank you so much for this privilege. I look forward to connecting with you and creating some individualized solutions. It is possible to have lymphedema and the life you love. It is possible to have cancer and the life you love. I'll talk to you soon on a Vital Lymph Solutions call.